really love the fact that there's so much education in dermatology. We're able to teach patients about their own skin, about how to take care of themselves. Their skin is something that it's right there. It's something that people can see. So when you help someone with their plaque psoriasis, you change their world. It's very rewarding.
People with psoriasis who have perhaps scalp psoriasis, nail psoriasis, they have a higher propensity to having joint disease. So I might take that more seriously and explain that to them.
I screen every psoriasis patient for joint involvement because I think it's a part of healthy practice, and I think it's my job as a dermatology PA that if I see something on the skin, I need to ensure that it's not systemic, or if it is, get them the proper management with my rheumatology colleagues. In my psoriasis patients, I treat the body as a whole, so address not only their skin symptoms, but their overall health and well-being. So I ask them how they're feeling, and then I address my therapy based upon what we've tried first line. And if we've tried things already, then we go to biologics and see if that offers improvement in how they feel overall.
I ask my plaque psoriasis patients about joint disease or any joint symptoms every single time that I see them. Even if I've already seen them previously and they were fine, they did not complain of any neck pain, back pain, ankle pain, I will still ask about it at their next visit and the following visit because we never know when it can eventually develop.
I think it's very important that we consider comorbidities with psoriasis. So first thing is educating our patients. Their disease is not just a skin disease. It goes much further. So evaluating the full body and teaching them that we have to treat the inflammation from within to get the best outcome.
Indications. COSENTYX secukinumab is indicated for the treatment of moderate to severe plaque psoriasis, PSO, in patients 6 years and older who are candidates for systemic therapy or phototherapy. COSENTYX is indicated for the treatment of active psoriatic arthritis, PSA, in patients 2 years of age and older. COSENTYX is indicated for the treatment of adult patients with active ankylosing spondylitis, AS. COSENTYX is indicated for the treatment of adult patients with active non-radiographic axial spondyloarthritis, NR-AXPA, with objective signs of inflammation. COSENTYX is indicated for the treatment of active enthesitis-related arthritis, ERA, in patients 4 years of age and older. COSENTYX is indicated for the treatment of adult patients with moderate to severe hidradenitis suppurativa, HS. Important safety information. Contraindications. COSENTYX is contraindicated in patients with a previous serious hypersensitivity reaction to secukinumab or to any of the excipients in COSENTYX. Cases of anaphylaxis and angioedema have been reported during treatment with COSENTYX. Warnings and precautions. Infections. COSENTYX may increase the risk of infections. In clinical trials, a higher rate of infections was observed in COSENTYX-treated subjects compared to placebo-treated subjects. In placebo-controlled clinical trials in subjects with moderate to severe PSO, higher rates of common infections such as nasopharyngitis, 11.4% versus 8.6%, upper respiratory tract infection, 2.5% versus 0.7%, and mucocutaneous infections with Candida, 1.2% versus 0.3%, were observed in subjects treated with COSENTYX compared to placebo-treated subjects. A similar increase in risk of infection in subjects treated with COSENTYX was seen in placebo-controlled trials in subjects with PSA, AS, and NRAxSpA. The incidence of some types of infections, including fungal infections, appeared to be dose-dependent in clinical trials. In the post-marketing setting, serious bacterial, viral, and fungal opportunistic infections and some fatal infections have been reported in patients receiving IL-17 inhibitors, including COSENTYX. Cases of hepatitis B virus reactivation have been reported. Exercise caution when considering the use of COSENTYX in patients with a chronic infection or a history of recurrent infection. Instruct patients to seek medical advice if signs or symptoms suggestive of an infection occur. If a patient develops a serious infection, monitor the patient closely and discontinue COSENTYX until the infection resolves. If signs of hepatitis B virus reactivation occur, consult a hepatitis specialist. COSENTYX is not recommended for use in patients with active viral hepatitis. Pre-treatment evaluation for tuberculosis. Evaluate patients for tuberculosis (TB) infection prior to initiating treatment with COSENTYX. Avoid administration of COSENTYX to patients with active TB infection. Initiate treatment of latent TB prior to administering COSENTYX. Consider anti-TB therapy prior to initiation of COSENTYX in patients with a past history of latent or active TB in whom an adequate course of treatment cannot be confirmed. Monitor patients closely for signs and symptoms of active TB during and after treatment. Inflammatory bowel disease. Inflammatory bowel disease, IBD, exacerbations, in some cases serious and/or leading to discontinuation of COSENTYX, occurred in COSENTYX-treated subjects during clinical trials in PSO, PSA, AS, NRAxSpA, and HS. In adult subjects with HS, the incidence of IBD was higher in subjects who received COSENTYX 300 mg every 2 weeks, ulcerative colitis UC 1 case, EAIR 0.2 out of 100 subject years, Crohn's disease CD 1 case, EAIR 0.2 out of 100 subject years, compared to subjects who received COSENTYX 300 mg every 4 weeks, IBD 1 case, EAIR 0.2 out of 100 subject years. In addition, new onset IBD cases occurred in subjects treated with COSENTYX in clinical trials. In an exploratory trial in 59 subjects with active Crohn's disease, COSENTYX is not approved for the treatment of Crohn's disease. There were trends toward greater disease activity and increased adverse reactions in subjects treated with COSENTYX as compared to placebo-treated subjects. Exercise caution when prescribing COSENTYX to patients with IBD. Patients treated with COSENTYX should be monitored for signs and symptoms of IBD. Eczematous eruptions. In post-marketing reports, cases of severe eczematous eruptions, including atopic dermatitis-like eruptions, dyshydrotic eczema, and erythroderma, were reported in patients receiving COSENTYX. Some cases resulted in hospitalization. The onset of eczematous eruptions was variable, ranging from days to months after the first dose of COSENTYX. Treatment may need to be discontinued to resolve the eczematous eruption. Some patients were successfully treated for eczematous eruptions while continuing COSENTYX. Hypersensitivity reactions. Serious hypersensitivity reactions, including anaphylaxis, angioedema, and urticaria, have been reported in COSENTYX-treated subjects in clinical trials and in the post-marketing setting. If an anaphylactic or other serious allergic reaction occurs, immediately discontinue administration of COSENTYX and initiate appropriate therapy. The removable caps of the COSENTYX Senso-Ready pen and the COSENTYX 1 ml and 0.5 ml pre-filled syringes contain natural rubber latex, which may cause an allergic reaction in latex-sensitive individuals. The safe use of the COSENTYX Senso-Ready pen or pre-filled syringe in latex-sensitive individuals has not been studied. Immunizations. Prior to initiating therapy with COSENTYX, consider completion of all age-appropriate immunizations according to current immunization guidelines. COSENTYX may alter a patient's immune response to live vaccines. Avoid use of live vaccines in patients treated with COSENTYX. Most common adverse reactions. Most common adverse reactions, greater than 1%, are nasopharyngitis, diarrhea, and upper respiratory tract infection.